Hi, everyone. Welcome back to Misconceptions. I am excited to welcome a new colleague, a new friend, somebody I kind of have only met really virtually, unless we include the time that you and I met in a training many years ago in Philadelphia. But welcome, Katie. Thank you so much for being here.
Thanks so much for having me, Deborah. I really appreciate it.
Absolutely. So, our conversation today is going to be about lactation and about feeding babies and kind of getting a sense of the kind of mainstream knowledge and also some of the challenges that women face when talking about feeding their children. And I'd love for you to start this conversation off with telling us a little bit about yourself and how you got involved in this work, some of your professional, kind of education. Let us in on who you are.
Yeah, I would be happy to. So my name is Katie Prezas. I'm an international board certified lactation consultant and perinatal mental health certified clinician through Postpartum Support International or PSI. I live just outside of Chicago in the suburbs near O'Hare Airport, where I do mostly home visiting. So helping people in their space figure out how to feed their babies, whether that's on the body through pumping and bottle feeding or formula or a blend of all three. I also see patients once a week at the Birth Center of Chicago, and there I partner with a speech language pathologist where we do a lot of work around tethered oral tissues. So tongue ties, lip ties, that sort of thing. So when lactation isn't going quite as we had planned, and maybe there's an underlying anatomical issue, that's kind of what we tackle, me and my colleague over there. So I also offer telehealth. Um, I am the current president of the Northern Illinois Lactation Consultant Association. I used to be the vice chair of the PSI chapter here in Illinois. I also led the Climb Out of the Darkness for PSI twice here in Chicago in 2022 and 2023. So this is about a 5-year-old career for me, but I have jumped in with both feet. Um,
Clearly.
and I am very passionate about helping families figure out how to best feed their children in ways that support their mental health, but also make sure that the parents are meeting their goals, while also supporting their overall well-being. So,
So I want to start with the technical, and
yeah.
then I want to get into the mental health. But the technical, to me, when you bring up that, I love that you work in collaboration with a speech language pathologist, like recognizing that there can be some physical barriers for a baby to be able to breastfeed or to latch or to, kind of create a positive feeding experience. Can we start there? Help me understand, because it feels like this is something that has kind of shown up maybe only within the last 15 to 20 years. This was never a conversation when I had my oldest, probably two children. And yet I think that it's come up quite a bit more recently where we're hearing a lot more about it. And I'm also hearing kind of the conflict in it that some people don't buy in as this being a source of a problem in feeding experiences. Can you help me understand, like, what are some of the things that you are seeing and have learned over the years about lactation and anatomical differences that some children have?
Yeah, I'm so glad you asked this question because we get a lot of questions about this, and I feel like this is one of the topics that is most confusing for parents to try to navigate on their own, right? Because not just for tongue ties, but all of lactation. A lot of times, the only source of information that parents are using is social media, right? So TikTok and Instagram, and you can find all sorts of opinions out there. But the truth of the matter is, since the 1980s, more and more parents, especially in the United States, have tried breastfeeding and are committed to making it work, right? They're motivated to figure this out. And, so although it feels like there's more tongue ties now than there ever has been before, it's kind of a sampling error, right? Because if more, I wasn't breastfed. I'm about to be 40. My husband wasn't breastfed, right? There was a whole generation that went straight to formula, right? Didn't even give breastfeeding a try. And when you're bottle feeding, a tongue tie or a lip tie, those sorts of anatomical differences don't really come into play. And if they do, it's because they're very severe, right? And so those would always be caught by a pediatrician, or a midwife or something like that. But now more and more people are trying to breastfeed. And when they run into issues, they're asking for help, right? As opposed to just giving up and switching to formula. So when, especially for someone like me, like a lactation professional, we're going to see a very high percentage of babies with tongue ties because only the parents who are struggling are reaching out to me. The ones
Okay.
who figured it out and are having a great feeding experience, I'm never going to hear from those folks, right? The other thing that's important to remember is that a tongue tie, right? So we're talking about the string of tissue at the beneath the tongue that holds the bottom of the tongue to the floor of the mouth. That is a normal piece of anatomy. We all have it, right? And it varies, just like our hair color or eye color, right? Sometimes it's really thick, sometimes it's really thin, sometimes it's further forward versus further backward. Sometimes it's tight versus loose, right? So it's a normal piece of anatomy. We consider it a tie when it starts to impact function in some way. So things that we see, right? Parent is reporting nipple pain, either at the beginning of a feeding or throughout a feeding. And this usually lasts like beyond those first week or two where you're still trying to get your bearings and figure out what's going on, how to even feed a baby. So cracked, damaged, bleeding nipple tissue, right? Things where we're feeding frequently enough, but that supply just isn't quite there where we want it to be. Or baby was gaining weight great and now they're not, right? Well, why? The supply hasn't changed, the latch hasn't changed. Like what's going on? So when we see these ongoing issues, that's when we're digging deeper into, okay, well, what else could be happening here? And so one of the things I do, since this is kind of one of my subspecialties within lactation, is I always do an oral assessment. So I look to see what's going on inside of that mouth, coupled with what is the feeding experience like, whether that's on a body or on a bottle. Is the baby leaking a lot? Is the baby clicking a lot? Does the baby seem extraordinarily gassy, right? Babies are always gassy and kind of fussy. But is there something else going on here anatomically that might be the cause of this? And so that's where we take a combination of the symptoms that are presenting from the parent, from the baby, and from the pair of them during the feeding experience, coupled with what it actually looks like inside the mouth. And then we figure out, is this something that needs to be addressed or not? Because the other thing too is sometimes you look inside that mouth and I'll look and I'll think to myself, wow, is this baby tight, right?
Mm.
And then you look at breastfeeding and it's beautiful. And they're transferring all the milk and mom doesn't have any pain and everything's great. Well, then there's nothing to do, right? There is no issue. Sometimes mom's anatomy and baby's anatomy, regardless of kind of what it looks like, they're able to figure it out. And so it's kind of a non-issue. So we only consider it a tie when it's really causing some sort of impeded
Like
function,
destruction.
the
Mhm.
feeding experience isn't going as great, that sort of thing.
So I want to understand like anatomically. So if you have a tongue tie, something is kind of disrupting the feeding experience and it's causing mom pain. So the nipple is cracked or there's pain that's happening there. What is it about that experience? Why is it that the tongue tie is associated or correlated with pain or cracking nipples? I'm not sure I'm understanding that.
Yes, that's a great question. Okay, so when a baby is successfully nursing at a breast, right, they are meant to get a mouthful of breast tissue. So not just the nipple. They get areola, breast tissue, nipple, all in the mouth. And when they do that, they successfully create a seal around the breast with the lips, right? And then the tongue moves in such a way inside the mouth that it's creating vacuum and literally sucking, right, the milk out of that breast. When they get a nice deep latch like that, the nipple inside the mouth, if you were to look kind of profile at the baby, right, the nipple ends up very far back in their oral cavity. And if the nipple is touching anything, right, as the tongue is kind of moving up and down, the nipple is touching soft palate. So if you
Hmm.
take your tongue right now as an adult and you run your tongue from right behind your front teeth up and towards the back, right, towards your throat, right behind your front teeth is very hard, right? But as you go backwards, it gets softer and spongier, right? So when a baby is nursing deeply and the nipple is nice and far back in the mouth, mom's nipple has lots of cushion, right? And if it is
Hmm.
touching that soft palate, it's very forgiving, right? Now, a tongue-tied baby, they can't quite get enough breast tissue in the mouth. And that's because several reasons, right? Function of the tongue. A lot of times they can't open their mouth as wide as a baby who isn't quite as tight. And so the nipple ends up much more in a shallow position inside the mouth, right behind where those front teeth are going to come in. So if you feel that again with your tongue, right, that's basically bone wrapped in a little bit of gum tissue. And so if you think of that tongue moving up and down during nursing and pushing that nipple up against the front part of that hard palate, right, it's basically being pushed up against bone
Mm.
repeatedly, right, for up to 30 minutes during a feeding, right, 8 to 12 times a day. Okay. Now, the skin on my arm could handle that sort of pressure and friction. But nipple tissue, nipple skin is much more delicate. It's very fragile. So when you're putting that sort of friction and pressure on that nipple tissue right at the front of that baby's mouth, it doesn't take very long for that tissue to open up, right? Bleed, or you get like blistering or tenderness, that sort of thing. It's just not designed to rest right there. It's designed to be very deep in the mouth. The other thing, so that's why it's causing pain, right? Is because that nipple, the tongue is supposed to protect the nipple, pull the nipple further back into the mouth. And when you're tied, you can't quite do it. The other thing that parents also report is it feels like they're biting, right? Or like they're kind of gumming the nipple. And what that is when we're nursing, when a baby is nursing, the tongue is supposed to extend out of the mouth or, forward in the mouth a little bit and cover up the bottom gums where, right, baby's little two front teeth are eventually going to pop out on that bottom gum ridge. And what that does is when the nipple comes out, it's protecting, right? It's like a little tongue pillow for your nipple, right? Well, if you're tied, right, you think of that tongue, it's constantly being pulled backwards. And so it can't stay on that gum ridge the whole time. So it might feel comfortable for a few sucks and then it kind of slips back and you feel that gumming sensation.
Hmm.
And then they're able to put it out again and it feels more comfortable and then it slips back, right? And you think they're working against their anatomy, right? They're pushing forward while that anatomy is pulling backward. And so that gets really tiring. So as you get towards the end of a feeding, especially, that tongue keeps slipping more and more backwards towards the airway, right? And then mom's nipple is rubbing against that bottom gum ridge in baby's mouth. And again, applying too much pressure and friction to that nipple, which is why it feels like that sort of biting sensation.
And I would imagine also that there must be some exhaustion of the baby at the end by, if it's become more complicated for the baby to feed, for
Exactly.
more tired, not getting enough, falling asleep at the breast, or just not getting enough nutrition, right?
Yes. They're working really hard, right? It's literally like
Hmm.
if I was trying to run and someone was holding my shirt behind me, eventually my legs are going to gas out,
Yeah,
right? Like I'm
right, right.
trying, but I'm not really getting anywhere. So I'm going to
Hmm.
stop, right?
Hmm.
So, the issue with a tongue tied long term is, obviously there's issues with feeding, with bottles, with solids. That it can translate into speech issues once they're, developing speech. But from a lactation perspective, if the baby isn't able to efficiently latch, right, get a nice deep latch, we don't just want a deep latch because moms don't want their nipples to hurt, right? Like there's an evolutionary biological reason why we need a deep latch, and that's because a deeper latch gets more milk out of the breast than a shallower latch, right?
Hmm.
So it's not just for selfish reasons. When a baby is tied and they have a shallow latch, they come to the breast and they don't take as much out, right? So let's say mom produced 4 ounces, baby comes to the breast, they only get 2.5 ounces because they're tied, right? That tongue is doing all its little work, but it can't quite get there. Well, then mom's body gets a signal. Well, I made 4 ounces. You only used 2.5 ounces. So now I'm going to start to slowly decrease until I get to 2.5 ounces, right?
Hmm.
And so it's once we get to a certain point in lactation, right, it's supply and demand. So whatever we're taking out, that's what the body's going to replace. And if you have a baby who isn't feeding efficiently, eventually that supply just keeps going down, 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 right? Then baby's weight gain pattern starts to fluctuate. And the pediatrician, sometimes even at like the 2 or 3 month appointment, they're like, they were fine. And now they're kind of plateauing on that growth curve. What's going on? Right. And nothing else has changed.
Hmm. Hmm.
Feeding pattern is the same, all of that sort of stuff. But it could be because of that anatomy that's going on. Um,
Fascinating. What are some
yeah,
of the other things that you've seen that can prevent good feeding? What are some of the things you know about either, let's start with biologically or anatomically with babies that we know prevents a good feed or a good feeding experience for babies?
yeah. So I think the biggest issue and one of the kind of misconceptions, right, about feeding is that we as the birth parent are supposed to know what to do. and I'm not sure exactly how we're supposed to know how to do that, right?
They never came with
Um,
instructions. They never came
right.
with a
They did not
single
come with
manual.
instructions. And as far as I know, no one has given birth and something comes down from above and gets planted into your brain of like, and now I know how to feed this baby, right?
Right.
Breastfeeding is a socially learned skill. It is not innate. Birth parents do not have feeding reflexes. We have caretaking reflexes, right? Like my baby is crying, I pick them up, right? You walk into a room of moms, you know they're all moms because one baby is crying and everyone's rocking back and forth, right? We all have those sort of instincts on how to just like caretake, but we don't have feeding instincts. Babies are born with feeding instincts, right? They have a rooting reflex, they have a sucking reflex. You touch their chin. If they're hungry, they will open their mouth widely and try to latch onto that finger. But moms don't have feeding reflexes. And so, one of the biggest issues, I think, is that we think we are supposed to know. We think breastfeeding is natural, therefore, I'm supposed to know how to do it. And if I don't, I'm a failure, right? Like everyone else knows how to do this except me. But the issue is socially and culturally, we don't grow up seeing breastfeeding or learning anything about breastfeeding, right? Who learned about the breast in health class in high school? Nobody, right? We didn't learn about the breast's natural physiological function. Even medical students and doctors don't learn about that. They only learn about breast cancer, right? So it's kind of a black hole, right? And so unless you happen to grow up in a family where one, you're very connected to all of these other women who are birthing children and happen to be breastfeeding them, and you kind of grow up and are raised around that, maybe you would kind of know what to do when you had your own kid. But we don't live like that. And especially since COVID, we're very isolated in our motherhood journey, especially at the beginning, right? Germs and all of that stuff. And so we turn to social media, which is kind of a mixed bag on what you're going to find out there. And so instead of socially learning this from our social circles, right? Even 100 years ago, right? We would give birth at home, we'd walk out into our community, and there'd be the grandma down the street, and the aunt, and this cousin, and the
Right.
old lady, and all of these women, right, would gather around us, and they would teach us, oh, honey, try putting your hand here. Oh, try holding him like this. Oh, have you tried this? Right? This is what really worked for me. Right? They would pass down this generational knowledge of how to caretake and feed infants. We don't live like that anymore. So
Can I also acknowledge that like in the reality also, as I think maybe some of this is generational, I don't know, maybe it's cultural or sociocultural, but I also think that we've developed a certain amount of like I not only am I supposed to know what to do, but don't tell me what to do. Right? Like
yes,
meaning I don't want my mother telling me how to breastfeed the baby. Definitely don't want my mother-in-law telling me how to breastfeed the baby, right? Like there's a
yes,
certain yes, we don't live in that communal intergenerational experience where the grandmother shows up to help the new mom breastfeed. There are those cultures and communities where that does exist. But I think that even in a community where breastfeeding is by far normalized and almost, I would say, a pseudo expectation, I would still say that it's more often talked about as it's so amazing, it's so beautiful, it's so great, but the hard parts of it are not necessarily as openly discussed because it feels almost like a breach of what I should be doing. Like I
mhm,
should be, or it needs to be something that is normal and everybody does it. And so if I struggle with it, it's almost a shame or an
yes,
embarrassment that
yes,
I don't know how to do this differently than differently, and I don't know how to make this better. So
right,
while we don't we some I would say for sure within the religious Jewish community there's definitely a stronger identity of communal living, but I don't know that we really highlight when things aren't going well, especially when it comes to breastfeeding. There's definitely lots of lactation and consultants and people that are available to help, but as a community I think we talk more about when it's working versus when it's not working, and I think that's probably kind of a universal experience.
yes, definitely. And because we don't learn this in community anymore, right? Like, hence why a lactation consultant is even a profession, right? That now we need the expert
Right.
to come in who has been trained on right physiology of lactation and how do we support milk production and how do we hold and latch a baby and all of that sort of stuff.
For sure.
But it is very, very anxiety ridden. There is a ton of shame and expectation and all of this stuff wrapped up in this feeding decision. And either people are really happy with their successes, right? They're struggling in silence, right? They don't ask for help, or they struggled and they switched to formula, and that they're willing to broadcast, right? Oh, I had cracked and bleeding nipples at week 2. I switched to formula. I'm so much better now. That sort of thing. And it's hard too because unless you're under the care of a lactation consultant, pediatricians don't get a lot of infant feeding experience, right? But that's who parents inherently trust for advice, right? And I was just reading an article yesterday, and they was saying how pediatricians aren't well suited or motivated to help a mom and a baby troubleshoot lactation issues, right? Because formula is an easy alternative, right? Just
Well, I
here,
don't, I also,
take this.
I think we have to, I think that's true, but I also think
Yeah,
that it's because the structure of our system doesn't allow more than a 5 to 7 minute meeting with your pediatrician, right? Like
correct.
if you're concierge, maybe you have a chance to
Yes,
sit for an hour with your pediatrician, but if you're not, you're in and out. You're checking milestones, you're checking weight, you're checking height, you're checking growth, and anything that we need to discuss, move along. Most likely, barely even getting assessed for parental depression, right? Or
yes,
perinatal depression.
yes,
So I think you're right, but also, right, there really isn't a structure that allows for pediatricians to
correct.
even potentially, troubleshoot or create an alternative. I
Yeah,
want to move into the conversation of the impact of mental health and the correlation or the connection of mental health and feeding. I think one of the things that we hear the loudest is this feeling of I got it wrong or I can't get it right, or if I move over to formula, I failed. Like I've actually failed. And I want to put aside, just for the purpose of this conversation, I'm putting aside people who are physically or let's go say physically unable to breastfeed. So for
yeah,
example, somebody who has a history, of course, of a mastectomy, for any reason, they would not be able to breastfeed. And so or some women who've had breast reduction or breast enhancing surgery may not be able to breastfeed. I know there's an attempt always to preserve that possibility, but for many women, that's not available. So putting that to the side, but women who thought that everything would work, right? The expectation was the breast would work, the breast milk would come in, and I'd be fine. Um, I want to explore with you a little bit more about the correlation between that and maternal health or maternal mental health, right? So I
yeah.
hear the distress of I feel like such a failure and I'm miserable. Like that's where I get them is like I am so unhappy with this. I very often I'm going to go with and I've worked with a lactation consultant and I wasn't successful. And I'm miserable and my baby is miserable and maybe even my baby's losing weight. I want to talk about kind of the emotional reality for women who wanted to breastfeed and were unable to breastfeed or really, really struggling. What are you hearing as a lactation professional?
Yeah. So that's always, for me, worst case scenario, right? Someone who's very motivated, who's very committed, and potentially due to an anatomical issue or a biological issue, right? We're not able to figure out why the production isn't there or, that sort of thing. And really, whatever your goal was, anytime you don't meet that expectation, there's grief there. And because of socially how motherhood is handled via social media and within friend groups and that sort of thing, um, breastfeeding moms who don't find the success that they want, there's no place for them to let those feelings out, right? It's not okay to say, I couldn't breastfeed the way I wanted to or as long as I wanted to, and I'm really sad about it. Because everyone's default reaction is, but formula, your baby's going to be okay. Don't worry about it. Oh, it was only temporary anyways.
Or I have the best lactation consultant out there, and I'm telling you, she could have been able to help you, and she would have been able to get you breastfeeding, right?
Yes. Yes.
Okay.
And it's similar to like a birth trauma, right? I envisioned this very specific process of how this baby was going to come into the world, and part or none of that happened,
Hmm.
right?
Hmm.
And so then you're stuck in this place of like mistrusting your body and wanting to redevelop that self-efficacy, self-esteem, that sort of thing. And so I tend to focus with my clients who are right, obviously after we've done all the troubleshooting and trying to get it back on the rails. So my first suggestion is if you're not meeting your feeding goals, please make sure you're working with a lactation consultant. Like, don't go to TikTok, don't go to Instagram, go to someone who knows what they're talking about. And if you meet with one and you don't get a good vibe, meet with a different one, right? It's kind of like a therapist. Like, I'm going to be a great lactation consultant for some people, and other people, I'm not going to be their cup of tea. And that's okay, right? But you want to feel someone, be working with someone that you feel good about their approach, their style, and that you feel well grounded in the information that they're sharing with you, right?
Hmm.
Um, so, but once we've kind of worked out trying to troubleshoot the issues, if we're still having problems, or I know that we're not going to be able to get to where this parent wants to be in terms of goals, I tend to refocus the conversation of, your baby loves you. They're finding comfort with you, regardless of whether or not there's calories being transferred one direction or the other, right? Breastfeeding isn't just about milk. It's about parenting. It's about mothering.
Mm.
It's about building a connection with your baby that no one else has and no one else can replace. So regardless of how many ounces or how many milliliters they're transferring at the breast, them suckling on your body is helping you and it's helping them, right? So refocusing on, do we want to switch to nursing for comfort? And we can rely on calories and growth and that sort of stuff with either formula or donor milk or whatever, right? I tend to focus on talking parents through, like, look at how they're looking at you. Like, I'm being goofy, that sort of thing. All they want to do, they've got eyes locked on you, right? They love you so much. Look at how you're attending to them. They make a noise, you pick them up. You know exactly what to do, right? Breastfeeding is not equivalent to your parenting experience. It's one small piece, honestly, right? When you look at how old your children are going to grow and how much of your experience is going to be this one piece, all things considered, right? It is a very small piece. It's an important one. And especially when you're in that phase of life, it feels all encompassing. But the most important thing to me, and why I wish more people would breastfeed, is the connection that you have with your baby, is the attunement that you develop through this feeding relationship. It's not about calories in, calories out.
Which I think also speaks to this idea of, like, sometimes I've seen where women have made the decision to switch to formula feeding for every reason under the sun. And sometimes they feel like I can then surrender. I have to, or I just surrender the connection piece of it, the attending piece. So basically they're like, well, if I'm not breastfeeding, I can either prop the bottle, or my husband will feed the baby, or my other kids will feed the baby. And because why would I have the why would I have the kind of either responsibility or privilege of just sitting and holding my baby while I feed my baby because I'm not breastfeeding the baby. Like, I had a client that I worked with, a remarkable woman who had lost a baby to a very severe fetal anomaly diagnosis. And then when she had the next child, like, the plan was, I'm going to feed the baby, I'm going to breastfeed the baby. And then COVID hit. And it was just a chaotic experience. But what happened, and her doctor was said, like, you have to formula feed the baby because the baby is really regressing, and we have to feed the baby with formula. And when that happened, she began to just hand that baby off to, she had a night nurse, and she had her husband, and I was like, oh, no way. Like, we're going to reclaim that. You are going to lock your door. You're going to sit down in that rocking chair. You're going to hold that baby. You're going to make eye contact with the baby. You're going to talk and coo and attend. It doesn't matter that there isn't a breast in the mouth, right? And
Correct.
and that was a moment of awareness that I think nobody reminded her of. And I said, they can be banging on that door, mommy, I need to talk to you. Why can't you come in? Can I come in? Can you come out? Right? And I'm like, no, mommy's feeding the baby. It doesn't matter how you're feeding the baby in that moment.
Right.
You can reclaim the emotional experience of feeding the baby. I think that aligns very clearly with what you just discussed.
Yes. And it's, sitting with you. Even tell people, like, listen, skin to skin is great, even past like the first week. Skin to skin with you,
Exactly.
skin to skin with dad, skin to skin with grandma, whoever wants skin to, you get skin to skin, you get skin to skin, right? It's good for the person, the adult, right? It's also good for the baby. So these things, they're releasing feel-good hormones in our bodies. They're promoting that bonding experience. And that's something that is what's going to last beyond your breastfeeding experience, right? Is that bond and that attunement that you end up having to that baby. And I'm always, even when I see, so, I have my PMHC, I screen all of my patients for anxiety, for depression, for OCD. And even when I see people who are scoring kind of high on that stuff, right? If they are feeding their baby or even just holding their baby, and I can tell they are attuned to what this baby needs, like, right, they're stroking their hair, or they're looking at their little fingers, or they're, moving their leg because they think they might be a little uncomfortable or whatever. I know those parents are going to be okay, right? Like, we're going to get through the rough patch and they're going to be fine. It's the parents who aren't attuned that worry me the most, regardless of
Mhm.
what their scores say. Usually their scores look fine, right? But when they
Mm.
seem kind of disconnected from the baby, from the feeding experience, right? The baby's crying, they don't really know what to do, or what they're doing isn't working and they're not adjusting their strategy, right? Those parents who, right, to your point, they kind of hand off the response, here, dad, here, grandma, that sort of thing. And they're missing out on that ability to really learn what baby needs. I always love it when a mom tells me, I can tell the cry when they're hungry and I can tell the cry when they're tired, right? I'm like, perfect. Whatever else is going on, you're doing a great job because you're
Right.
learning your baby, right?
Mhm.
Like nobody else can learn them.
Can we
And
talk a little bit about the, can we talk a little bit, I'm sorry to interrupt you. Can we
yeah,
talk a little
no,
bit? I want to talk about the shame because I think
yes,
that we can't have this conversation without acknowledging the significant shame that shows up when women are attempting, are trying, and are feeling like failures. And I love how you reframed like the value of the connection versus the value of the calorie exchange.
yes,
But I also just want people to hear the voice of the women who really struggle with the shame associated with being unsuccessful in breastfeeding or failing at breastfeeding, the
yes,
terminology they might use.
yeah, yeah. It's really tough, right? But so much of the shame and the guilt and how we kind of get in our own head about this stuff, it's all social and cultural, right?
Mm.
If you look at other cultures around the world, or even historically, right, that aren't as industrialized as we are and aren't as medicalized as we are, the failure rate, quote unquote, of lactation is extremely low. The number of parents who biologically are going to actually have issues producing a milk supply for their child is low. Okay. I am convinced that almost all production issues, unless there's a hormonal issue going on, are actually stress and anxiety issues.
Mm.
So stress comes in, anxiety comes in, right? Raises cortisol in the blood, which interferes with the lactation hormones, oxytocin and prolactin. And we get in our own head about baby's not getting enough. I'm not pumping enough, right? Then you go on Instagram and you're scrolling and you see these freezers full of milk. You're like, well, I don't have that much. Why don't I have that much? So then you go buy the lactation supplement, right? And you start pumping and doing all this stuff. And it's a very hard thing because lactation is counterintuitive to everything else of how else we have our lives structured right now, right? We're used to having an app for everything, scheduling everything, timing everything. Everything's planned out in advance. We wake up at a certain time, we go to bed at a certain time, we eat lunch, right? All of this stuff. It's very mechanized and time bound. And lactation isn't like that. Lactation is intuitive. You have to listen to what your body is cueing you to do and pay attention and listen to what your baby's body is telling you to do. And we're not used to doing that. We're used to using a clock to tell us what to do, right? Oh, it's noon. That means I'm supposed to eat lunch. Oh, it's 6 o'clock. That means I'm supposed to eat dinner. And so lactation, right? Our breasts don't come with the ounces on the side, right? 5, 4, 3, 2, 1, where like the baby nurses, and then we can see, oh, exactly, they got this much, right? So I know a lot of parents who, especially ones that tend to err on the side of higher anxiety, right, switch to exclusive pumping because it gives them a sense of control, right? They
Yeah.
get to control the timing, the output. They can see exactly, I put 3 ounces in this bottle and now it's empty and those 3 ounces are in my baby, right? And that's very comforting for them. But, right, and what people don't understand, and because we don't learn about this stuff, is that there are ways to tell a baby's getting enough at the breast. There's ways to tell in the baby, in their behavior at the breast, in how your body feels afterward, in the weight gain pattern, all of this, diaper output, all of this stuff. But we're not taught any of this. We're
Hmm.
used to
Hmm.
measuring and tracking and being able to visualize, right, all of these metrics and that sort of stuff. So it's very counterintuitive. And I think the shame comes in because you think it's this natural process that as someone born with a uterus, I'm supposed to know how to do this stuff.
Right.
And I don't, right? Just like when, I wanted to have an all natural birth and I ended up getting induced and having a C-section. It's like, well, that clearly my body doesn't know what it's doing, right? But here's the thing, and here's why I think lactation is so confusing. Pregnancy, once you're able to get and remain pregnant, right, which I know for some people is difficult, but once you get and maintain pregnancy, your body does the rest. It grows the bones, it grows the eyeballs, it grows the hair, right? It does all the things, and you really don't have to do anything. As long as you're eating something occasionally and drinking some water, it grows a baby for you. And then eventually, at some point, that baby is going to exit your body through one method or another, regardless of how much you know or don't know about childbirth, right? That baby will come out.
Hmm.
You don't really have to do anything. There's no work involved. Lactation isn't like that at all, but people think that it is, right? They think I'm just supposed to know what to do. I was born with a uterus. I'm supposed to know what to do. But lactation is more like riding a bike, right? You've never done it before. You have to use something at right. It's dancing. You're with a partner. It's not just one person, it's two people. You have to learn what to do. You have to practice in order to get better, right? And then even when you have a second baby, you might know what you're doing, but that baby's never breastfed before. So now you have to relearn again with a new partner, right? It's a skill that unless you do it really regularly and practice it and improve your skills, how else are you supposed to know what to do,
And
right?
I think that it is also something that we're trying to learn how to dance when we're exhausted. Right. And,
Right.
and
Sleep
and by the way, our
deprived.
body just had a major experience, right? Like a major
Yes.
physical experience. Most of us
Yeah.
would not consider going dancing or leaving the house in anything other than pajamas, right?
Right.
In the immediate aftermath of giving birth. And yet this dancing is occurring on a regular basis, many hours of the day with a baby that, I'm still trying to figure out the moves, right? The next move.
Right.
And so I'm so tired and I'm trying to figure out this person and this feeding experience.
Yes.
Could we talk
I
a little bit? Yeah, go ahead.
I tell my patients, so I'll help people with like bottle refusal, right? Sort of consults, and I'll tell them, listen, even as adults, we learn best when we're well fed and well rested. So we're going to try to introduce this bottle when this baby is well fed and well rested. Same thing. Can you imagine
Mm,
trying to learn a new skill? Like, let's learn how to do surgery 12 hours postpartum or 6 hours postpartum. You're in
right.
physical pain, you're in physical recovery, you haven't slept, right? No one's going to learn well, which is why, in my opinion, all OBs, all midwives should be referring every pregnant patient to prenatal lactation consult, right? To learn about lactation, to understand what in their medical history might contribute to issues with milk production, things like thyroid issues, uh, insulin resistance, PCOS, anemia, bleeding during delivery, an induction, a C-section, any sort of hormonal issues, right? People that had fertility challenges, usually there's an underlying hormonal component. Have we figured that out yet? No, yes, maybe. That's something that as a lactation consultant might not be a red flag, but it's a pink flag, right? If
Right.
we're doing everything right in terms of routine and how many times we're bringing the baby to the breast and all that sort of stuff, and we're still struggling, like, oh, maybe it is a hormonal thing. Should we run labs for that? People even just knowing that before the baby gets here, and having advice for just the first few couple days after delivery of like, how often does a baby eat? What does it look like when they're on the breast? How do I hold them? Right? How do I
Right.
get a bunch of breast tissue in their mouth? I don't know what I'm doing. Right?
Right.
Um,
Right.
that would set people up for so much more success, but also just confidence that they know, have half a clue of how to
Of what
feed
they're
this
doing.
baby.
Yeah,
Yeah.
yeah. And I think you're right. It's just not a conversation we have unless when we're already running into a problem. Once there's a problem,
Right.
there's a referral. In other countries, my understanding is that lactation is kind of an approved and covered, experience of the postpartum period in some countries. Like that is something that we don't have that. I don't know. I assume it's definitely not federal, but the question is like what is allowed and what is encouraged by insurance companies will be very specific to each insurance in terms of if lactation consultation will be covered. You can definitely request it in a hospital. They will send you in
Yes.
somebody from the hospital, but that may be a one-time visit because you're only there 48 hours at the most of the time. So you may only have a one-time opportunity to have a conversation, and it
Yes.
may not be as detailed as we want. I think I would like to bring up mental health specifically in terms of depression and anxiety, and it's kind of the connection again, and I'm using that word very carefully because it's not causal, and there's a correlation is a little bit different than what you would expect it to be. But I do want to talk about mental illness and depression, anxiety, et cetera, in perinatal and postpartum and the relationship to breastfeeding. Do you want to take it to the data? I'm assuming you're
Yeah.
familiar with it. Why don't you
Yeah.
go with the data and we can have that conversation, and that's how we're going to finish out our conversation today.
Yes. So I actually host a training for therapists where I teach them how lactation and mental health are intertwined and what to look for, quote unquote, on the couch with a therapy client that might indicate they could use lactation support, right? Because we're so used to seeing all over social media, oh, my nipples are cracked and bleeding. Oh, it hurts. Oh, this, I'm struggling with supply, this, that, the other thing. And so it's become so commonplace that people don't realize, no, actually someone could help you with that, right? Like it doesn't have to be like that. We can get better, right? But usually, lactation and mental health have a bi-directional relationship, meaning lactation can impact mental health and vice versa, mental health can impact lactation. Typically what I see is when lactation is going well, it buoys mom's mental health, right? If it errs on the side of depressive symptoms or anxious symptoms, right, it can help increase her confidence, increase her parenting self-efficacy, and improve mood. The other thing about successful breastfeeding is that you got a whole lot of oxytocin flowing around in that system, which is elevating mood just in and of itself, right? Now, when breastfeeding is not going well, when there are problems, and that might be pain, that might be weight gain issues, that might be production issues, or a combination of all three, right? Then those parents can slide deeper into those depressive and anxious symptoms. And it's not that breastfeeding is bad for your mental health. It's that we lack the support of breastfeeding we need to find success, right? Whether that's friends or cousins or sisters and sisters-in-law who have done it before who can give you advice, or a lactation professional or your spouse or your pediatrician or your OB, right? A lactation support group. So many people don't realize that they should be reaching out for help with this stuff, right?
And
Um,
but also if I'm struggling with mental illness, I'm struggling with depression, anxiety, it's actually a little bit harder for me potentially to reach out and ask for that support,
Correct. Yes.
right?
People with postpartum depression tend to, one, have higher expectations of themselves when it comes to the feeding relationship and the feeding experience, and they have a harder time reaching out for support than people who aren't experiencing depression. So, all the more reason, right, why therapists or your OB or your pediatrician, if they're handing you that Edinburgh and you're seeing an elevated score, right, asking a follow-up question of like, how's feeding going, right? And if the answer isn't an immediate great, right? Hey, here's a list of a couple of lactation consultants that I know who can help you figure things out, right?
Yeah.
And it's not, to your point, right? Pediatricians, all doctors and healthcare providers are stretched so super thin right now that of course they don't have time to troubleshoot this stuff. Some of my sessions can be 90 minutes long to figure out all of this stuff. But at the very least, they could have a vetted list of providers that they refer out to for lactation support, right?
Absolutely. Absolutely. One thing I want to just make sure that we highlight, well, actually, two things. One is there is a kind of myth or a misinterpretation of the data that breastfeeding is protective of mental health, meaning that if I breastfeed, then I won't get postpartum depression or anxiety. And that is
Yeah.
not what the evidence shows. As Katie really described that quite perfectly, that bidirectional experience of how breastfeeding interacts or interplays with mental health. And that's very, not only is it accurate, it's an important way for us to understand the relationship between mental health and breastfeeding. I think it also speaks to this idea of like, if I want to breastfeed and I'm unable to breastfeed, it can impact my emotional health. Or if I don't want to breastfeed and I'm feeling pressure or being forced by family, community, or physicians to breastfeed or mental health provider or any kind of prescriber provider to breastfeed, that also can impact mental health, right? So we want to
Yes.
be listening as well. And I think this is a critical piece that, yes, it might be the best thing for all the reasons you described. And also for many different reasons, some women may say, this isn't working for me. And sometimes they need permission to say, as long as you're feeding your baby, like, let's talk about how you can create connection and attention and attending and feeding to our children if breastfeeding isn't the way that their child, like I used to describe that, that's not how we're going to exchange calories. Like the
Right.
calorie exchange is not going to happen.
Yep.
And why I think that's critical is that sometimes there are actual reasons why women cannot, not only physically, emotionally, sometimes the intensity of mental illness, of depression, anxiety, or OCD is so profound that the breastfeeding is out of reach for them. It is
Yes.
just too complicated emotionally. I want to acknowledge that for some women who have a history of sexual abuse, of child sexual abuse,
Yes.
or of any kind of assault, they may find breastfeeding very disorienting.
Yes.
That having a baby attend to their breast in that way can feel really actually quite threatening. And so they may make a decision not to. And then, of course, physical limitations like a mastectomy that would prevent breastfeeding. I also wanted to ask you to comment just for a moment of some of the disparities between women who are white and breastfeeding versus the Black women and breastfeeding issues. Just, I know I'm not giving it enough attention in this conversation, but could you talk a little bit about the health disparities when it comes to, and really the breastfeeding initiation rates are different and much less for women who are Black or women of color. Can you talk a
Yes.
little bit to that issue?
Yes. So for 1 second, going back to your point of lactating parents' expectation versus, wanting to versus not wanting to. Does the spouse want her to or not want her to? Does the family want her to or not? This is a multifaceted social cultural experience. I was reading a book, rereading a book actually recently called The Big Letdown by Kimberly Seals Aller. And she has an example in there. What she talks about is that breastfeeding is not a single decision that you make on day one of life.
Mm.
It's a decision you make every single day, like a diet, right? Am I going to make certain choices today or am I not? Do I have people in my life who are supporting me in these decisions or not? Right. And now to your point about racial disparities. Black women, Black families tend to breastfeed at significantly lower rates than white families for lots of reasons, right? There is generational trauma there, right, due to the history of slavery in America and throughout the world, where Black female slaves were forced to wet nurse their owners' children, right, at the expense of their own children, and that generational trauma trickles down into even Black parents that are giving birth today. So there is a lot wrapped up in Black breastfeeding. Now, there's a lot of initiatives to increase the rates of Black breastfeeding, but due to systemic racism and oppression that continues even to this day, there are lots of disparities, not just in the support of Black breastfeeding mothers, their maternal health, all of that sort of stuff, but also Black families tend to have jobs where they go back to work earlier, right? So then they end up having to end breastfeeding earlier. And, if you're going back to work at 2 or 3 weeks postpartum versus 12 or 16 weeks, that's a completely different breastfeeding journey, one group versus the other. So there's a lot of systemic and institutional reasons why Black breastfeeding is much more difficult and lacks way more support than what white families are experiencing, even in 2025, which isn't a fun thing to talk about, but it is accurate, right?
Yeah.
And so you think of there are tons of benefits to breastfeeding for the breastfeeding parent, for the breastfeeding baby, for society, all of this stuff. And then you think of these families who, have higher incident rates of PMADs and have lower breastfeeding rates, that they're lacking all of these benefits of the breastfeeding relationship, of the breast milk itself, all of that sort of stuff. And so there is still a lot more work to be done to increase access to lactation care in those communities, to increase the number of lactation consultants of color that are available to help those families, and to help, institutionally increase access to longer maternal leave so that you can spend time with your baby, and to potentially develop a breastfeeding relationship if that's,
What
something
you
that's a goal
choose.
of yours.
Right,
Yeah.
right. Thank you. Thank you for even briefly addressing that. Well, let's close out today with one or two misconceptions that you want to make sure our listeners know about when it comes to breastfeeding.
Yes. Okay. So I've already covered one, that first misconception is that breastfeeding is intuitive for the lactating parent. It is not. It is socially learned. So I highly recommend you find a breastfeeding class, a breastfeeding support group, or a lactation consultant in your area who can help you learn, especially if it's your first time breastfeeding a child, or if you tried with baby number one and it didn't go well, right? Baby number two might be an opportunity for redemption. So just because the first experience didn't go great doesn't mean the second one can't. Another one is that breastfeeding is not all or nothing, right? It's not 100% breastfeeding or 100% formula. There are many shades of gray in between. It is a choose your own adventure. And the person who gets to choose is the lactating parent, right? So if you want to do a combination of on the body feeding versus pumping versus formula, that is your prerogative. And a lactation consultant should be able to help you figure out how to make that work. And then the last one that we were just talking about, right, is the misconception that breastfeeding is bad for my mental health. No, it's not inherently, right? It's struggling with breastfeeding issues that can contribute to mental health issues. And it's the lack of adequate support, whether that's from a partner, from a friend, from a lactation professional, or another healthcare provider. So it's that lack of support that can be really overwhelming. So knowing where to look for lactation support. So I have a couple suggestions. One, the USLCA, so that's the United States Lactation Consultant Association, has a Find an IBCLC directory. You can go on there and put your zip code in and find someone in your area. And then there's also like lactation billing services that you can go in and be connected to a lactation consultant through one of those services. Most insurance plans that are PPOs at least will cover anywhere from 3 to 6 private lactation consultations free of charge to you. If you have an HMO or other healthcare plan, you can still see a lactation consultant and pay out of pocket, and they can provide you with a super bill that you can submit to insurance for possible reimbursement. So there are options out there. There are also many wonderful support groups or drop-in services that people provide at low cost. So kind of looking up on Google for those services in your area is highly recommended.
Fantastic. Katie, thank you. This has been quite a full conversation.
Yes.
I think we touched on a lot of different little things and a lot of big things. And I love the language that you introduced around feeding and around connection and attending to our babies and calorie exchange. That's a great way of
Yes.
thinking about it.
Yes.
So thank you so very much. We will link Katie's information in the episode if you'd like to reach out to her directly. So thank you so much for saying yes and for this wonderful conversation.
Thanks so much, Deborah. I appreciate it.